Little technical difficulties. Hi.
Well, good. Wait, tell me, can you still hear me?
Yeah, I hear you. Do you hear me?
Okay. Yeah.
Okay.
Um,
So, Rachel, I just wanted you to introduce Devora before we add her. And if you could
so first, I just wanted to talk a little bit about SVH fertility and what we're hoping to talk about tonight. I was thinking a lot recently, actually, about how the name of our division is somewhat of a misnomer, because I think when you hear the word fertility, you're not very often thinking about the full picture of maternal and reproductive mental health, and health in general. But since day one, we have made postpartum and the perinatal period very much a priority. That's something that we instituted from day one. So SVH fertility, of course, does help dozens, hundreds of couples dealing with infertility, pregnancy loss at any stage, but also the perinatal, what's called the perinatal period, which encompasses pregnancy as well as the first year of the baby's life, or that's what we included in our definition. An extremely robust and successful program in this area, but I think because we're called the fertility division, it's not often associated with these issues. But actually, we just finished 2 extremely successful support groups. One, which we call Power Moms, which is for women who are pregnant or have a baby up to a year old that are feeling a little more depressed or anxious. That one had 9 women in it. It was fantastic, thank God. And we also just ran a very successful support group for the first time called Postpartum Grads, where we had women who had previously had issues in a previous pregnancy or after a previous birth, and were preparing for a future pregnancy, which was also extremely well attended. We had 10 women in that support group. Wow. So just all this to say, we are certainly tackling this and have been for the past few years, but I think it was important to sort of come out here and sort of explain a little bit more about what maternal mental health is and why it's so important. Actually, one of the reasons that we did this is because studies have shown that women who have gone through infertility or pregnancy loss have a much higher chance of having a perinatal issue, which kind of makes sense if you think about it, because women who have a hard time getting pregnant or staying pregnant or have had a traumatic issue in the past have this guilt when suddenly motherhood is difficult, right? Like,
because you waited so long for this and now you're still not happy.
Exactly. And as we all know, motherhood is hard no matter what happened to you in the past. Suddenly it's like the equalizer of all equalizers, right? I don't care who you are and what you've been through, and this is hard, right. You know? And that guilt could really eat away at a person. So yes, so SVH Fertility has a very robust program and really hoping to expand it moving forward for all maternal mental health. But basically, anybody could call us. We'll do a mental health assessment, and we could just guide you on next steps, whether that means a referral to a therapist, a psychiatrist. In some instances, that might mean meals and a mother's helper. We do have case managers for everybody who is admitted as case, and they basically follow up with them for months until they're feeling like they are in a good place and that they have the resources that they need. We could direct them to outside organizations if necessary, and we also can refer to pelvic floor specialists, nutritionists, whatever that person might need in order to feel that they are getting through the pregnancy and postpartum period, the perinatal period, with, you know, feeling great, right, or better, or as best as they can. Right. So I think that is why I am so excited about tonight. Right? I feel like we've been talking about this for so long. And it's just awesome to do an Instagram Live about it. I know we've talked about it here and there, but it's been a while. And we are so lucky to be having Devora Enton on tonight, as well as Serge Mao. who I think so highly of, and I can't wait to watch you tonight, and can't wait for everyone to see what she's got. But just a little bit about Devorah Enton, who we have had on previously and was tremendous. So Devorah is a licensed clinical social worker with a perinatal mental health counselor certification. She specializes in reproductive and perinatal mental health with advanced training by Postpartum Support International, which is the #1, nationally recognized ASRM and the MISS Foundation in Compassion and Bereavement. Devorah is a clinical consultant for Yesh Tikva, who specializes in Jewish infertility, and Knafayim, our very close sisterhood dealing with pregnancy loss, and is a lead trainer for Postpartum Support International, recently launching their perinatal loss advanced training. As an adjunct professor at Wurzweiler School of Social Workers, she developed a maternal mental health curriculum for MSW students and teaches coping with loss. Devorah is the program director of UFCS Philly's Safety Kid Initiative, coordinating child abuse prevention programming across all Jewish day schools in Philadelphia. A recent graduate of Counsel for Relationship Sex Therapy postgraduate training, Devorah maintains a group private practice in Philadelphia and consults and presents nationally about mental health and supporting those in struggle. I am all of that to say.
Wow, yeah, that's a lot. Okay.
She's the best. And
yeah.
I'm going to be a rapt, attention I'm expecting. So, Sarah, good luck. You're going to be awesome.
Okay, so I'm going to add. I'm gonna
hop off. I'm gonna hop off. Wait, I'll hop off and then
we'll add her. Okay. So we'll see you soon. Thank you.
Okay, bye.
Okay, sorry guys, bear with me. We're gonna add Devorah. Hi.
Did it work? It worked.
Yes, it did. Hi.
Fantastic. Nice to see you. How are you?
Yes, I'm good. Nice to see you. I'm Sarah. I feel like we spoke, but we never saw each other. So it's nice to put a face to the name.
A pleasure to me. I'm so excited that we're doing this evening, especially after that kind of introduction. I feel like a star. So thank you for making me feel so welcome.
No pressure. Very, very relaxed. No judgment zone.
So tell me, are you starting and telling me your story? I'd love to hear about what brings you to this conversation tonight.
Okay, so I'll be honest, Devorah, I was very nervous and hesitant to be the person on this live. But I see how important focus on postpartum is and how sometimes it gets dusted under the rug. So I couldn't pass up the opportunity. I am not gonna, go into such depth of my story, but a little bits and pieces is just, I had my second baby, and thank God I had an older one. They were pretty close together, and I would say I'm a very organized person in general. I have lists and I have to-do lists and check marks. That's just who I am as a person. So I was definitely, even throughout the pregnancy, I was very, okay, do I have everything in order? Do I have the sheets and this? I was very, on top of my lists. A little too much, some would say, a little too much, just relax, things will happen naturally. And after I had the baby, I just felt very overwhelmed. My heart was always beating in my chest. I didn't sleep so well. I was really, I don't want to diagnose myself and say that I was obsessed, but I was very attached to the baby. I had a nurse at the time, but yet I still felt like I couldn't, separate from the baby. I wanted to be with her at all times. I was constantly nursing, even when it wasn't time to nurse. If I was in my room, I was watching the monitor. I didn't really sleep at night. I was just glancing. Is the baby sleeping? Is she breathing? Is everything okay? I just felt very overwhelmed. Even though, in my head, I had a baby already and I did this, and why is this one, impacting me a little bit stronger? But I just felt very anxious, I would say, and very obsessive of my baby. If I barely left the house, if I left, I was watching the monitor like a hawk. I had a good support system, and that definitely helped me. But I also, at the time, I felt like also, like Rachel said prior, like it's a little embarrassing to tell someone, I got to this point, I finally have my baby that everyone's, you know, so excited for, and it's here and she's healthy and everything's good. But yet, why am I not feeling, oh, wow, I feel great. Yeah, I'm still feeling like, no, I'm not so good. Like, I'm not so good. I don't know why, but I'm not so good. So that's like, just, we'll go into it as we speak, but
Yeah.
that's basically just why I'm here. Rachel was a huge help for me, and SBH Fertility were there, and it definitely helped me, even if I didn't realize it at the time. So I owe them this, and I hope that other people that feel even an ounce of what I felt realize, like, don't be afraid to reach out or do something, because even the smallest twist that someone could give you, or the advice, could change the whole direction, and you could feel so much better and rest easier.
So I think that what you just said is so important, that idea of like one small piece of information. To me, it's not even advice, it's just information. Knowledge is so powerful. When you said, like, the line you just said was, like, it's I'm not where I'm supposed to be, or I don't feel like I'm supposed to feel. And some of the other lines that I'll hear women say are things like, I'm just not myself, or I'm something's wrong, but I don't know what, or I just don't feel okay. And I think that's part, like, you know, identifying some of the language that we hear from women is so crucial, because, you know, it's not always I feel depressed or I feel anxious. It's something's wrong. And it's interesting, because when I talk to like the OBGYNs or the midwives, we talk about that. Like, what you might hear is not I'm sad, it's not I'm depressed, I feel hopeless. It's like I something's just wrong, I'm just not myself. And I think that like like you said, you were doing everything that you needed to do, like, as a mom, right? You were feeding and bathing and taking care of the baby and checking on, if anything, you would say you were an amazing mom. You were extra taking care of that baby, but you knew something was just not right. And anybody telling you, no, it's good, Baruch Hashem, it's great, it's a, you know, this is exactly what you need to be doing, and yes, it's so hard, then, you know, it confuses you, because you're going, I'm just not like how I'm supposed to feel. You know, one of the things that I think is so complicated in our space as a religious or broad Jewish community, is how we come to motherhood holds so much expectation, and also a lot of assumptions about what it's supposed to be like, right? Like, since we were very, very little, we're pushing little baby strollers, and I know my children would stuff their bellies with pillows, right? Like, we knew we were going to become a mother no matter what. So that's where the fertility challenge comes in, right? Because it didn't go as planned. But then we don't realize that even motherhood can also not go as planned. We know that about 1 in 5 to 7 women, 1 in 5 to 7 women will experience a perinatal mood disorder. Organizations across the country in the Orthodox or Jewish community focus on pregnancy-related mental health. Extremely few, and those that are active are kind of resurging their interest in engaging in the community. There's very, very few organizations right now who are actively engaging in perinatal mood disorders. Right. But if I asked you how many organizations support children with cancer, you could list me an arm's length, right, of religious or Jewish organizations that do that. Childhood cancers, thank God, is not 1 in 5 and 7. It's not 1 in 5 or 1 in 7. It's a lot fewer children than that. And yet, for some reason, that's what we talk about much more than we talk about this difficulty in motherhood. And I think that really speaks to so much of the stigma that's associated with it. Like, I'm supposed to feel something, and if I don't, there's something really wrong with me, and I don't even know how to put that into words, right? I think the other thing I want to introduce also is this idea of, like, what are some of the cultural influences that we have relating to how we think about motherhood? It's maybe how we were raised, but it's also a lot of the influences of the magazines and the movies and the books we read teach us that motherhood is natural. Motherhood, everybody's happy. We're so excited. Every movie you watch, every video clip you watch on Instagram is about, you know, the announcing the pregnancies, announcing the gender reveals, you know, the sex reveals, and telling your mother you're pregnant, and the surprise. And it's so heartwarming, and I'm crying, and it's amazing. And it's like, could somebody talk a little bit about the hard stuff? Like, it's gross. Right. Like, sometimes it's just gross, right? And I think that not only, it's also can be really hard. And if we don't talk about the part that's hard, all we think is, I'm crazy. Something is wrong with me, but it's me. It's not what is going on with me. And I think that's where we get disoriented in this experience. So one last plug I have to put in is that we say 1 in 5 to 1 in 7 women will experience a perinatal mood disorder. But I will tell you that we know at least 1 in 10 men will experience it as well. So some of you on this line are going to be like, what are you talking about? That was all hormones, right? Like I thought it was all hormones. And like, it's not fair. He gets to claim some space in the perinatal. Yeah. It's a part of this, really? Seriously? Like, no, he doesn't, right? A lot of women will struggle with that idea. But I think actually what that does is it affirms for us that it's not just hormonal, and that it actually is something that is happening because of what we're trying to deal with in our lives in that transition to parenthood. And then ultimately, even if it's transition to parenthood of 2, right? Or dealing with something new that came into my life, baby number 3. So it's not every time I get, it is every time I get pregnant, I am at risk of struggling. And that's a little bit difficult to swallow, right? It's not like, well, I'm done. I don't have a history. I'm fine. No. I've seen women struggle after number 5, right?
Yeah, that's very interesting.
Yeah. Tell me something you want to hear from me. What are some of the things that are on your mind, knowing what you've been through? What do you want to talk about?
So we have a list of questions, but we have a lot to learn, and maybe let's get started on like what your work focuses on, and like what's the most common issues with maternal mental health? Like what do you see the most? What symptoms? What would those symptoms be? And like how long is too long to reach out?
Okay, that's like a long question, right? So let's start. I want to start with what we see the most. So what I just said in terms of what we hear from women, the most is what I just said. Something's not right. I don't feel like myself. There's something that I'm not understanding about what's going on. I don't feel okay. Maybe I'm not doing a good job. Maybe I made a terrible mistake. We'll hear that also. In terms of what some of the presentation of symptoms will look like. So one of the things that we need to understand is perinatal mood and anxiety disorder. Sometimes we abridge that into the acronym PMAD. There's actually some pushback on that, not to use the word PMAD because of the word mad in there. That could sound like madness, and this is not madness. This is an illness that we have to recover from. But let's just say for the purpose of our conversation, a perinatal mood and anxiety disorder, PMADs, are an umbrella of disorders. It's not a spectrum. It's not like the light version is baby blues and the really scary version is psychosis. We're not looking at it as a spectrum disorder. Imagine you have an umbrella, and underneath this umbrella are all these different pieces of how people might experience mood disruption during pregnancy and postpartum. Now, let's start with the one that I think is the most misunderstood, which is the baby blues. So anybody who says to you, oh yeah, I had a touch of the baby blues like 6 months after I gave birth, that's not the baby blues. Baby blues is exclusively within the 2 weeks after you give birth. Anything beyond that is something else. Okay. And that's kind of hard to like understand because some people are like, baby blues just sounds more natural, right? Less threatening, but it's only for the first 2 weeks. And the baby blues is I'm crying. I'm like, oh my gosh, how am I going to be a good mom? Or I don't know how I'm going to handle my baby and I'm so tired, right? And that's normal within the first 2 weeks, crying, sad, having a hard time, kind of managing all the tasks that I'm responsible for. Baby blues. Maybe even some regret can show up there, like, what did I do, right? That is baby blues. More than 2 weeks, that is no longer baby blues. Baby blues is not a disorder. It's a normal experience of hormonal and transitional disruption. But then we have, I'm going to highlight the main ones, which are depression, anxiety, OCD, and psychosis. I'm not going to go into PTSD, post-traumatic stress disorder, but that could present in the event that you're dealing with a post-trauma. So let's just focus on the depression and the anxiety. So what's fascinating is if you've heard anything about postpartum moods, you probably are thinking about depression. And some of you are saying, wait, anxiety is also a thing? OCD is also a thing in pregnancy and postpartum? So historically, you will even still hear some doctors who will be like, oh, she had a touch of postpartum. So let me just explain something to you. If you had a baby, you are now postpartum. It is a status. It is a status of an existing status of, it's an existence, right? Postpartum. You had a baby. Now you are postpartum. That means that you have to qualify it. It can be postpartum depression, but it can also be postpartum anxiety. We have interesting studies that have emerged over the last 5 years, really, that are showing significantly higher numbers of anxiety than of depression. So even though depression is kind of the most famous diagnosis, and it's really even referenced in hundreds and hundreds of years ago as puerperal fever. Even Hippocrates spoke about it, but it's not what we're seeing the most of today. I will tell you that most of what I see is anxiety. It's exactly what you described. What you said to me of, I kept checking on the monitor. I had a hard time sleeping. I would keep on feeding the baby because I'm not sure if my baby was satisfied or if my baby was hungry, or I would just, maybe I should feed the baby a little bit more to just top them off, right? Somebody else might be watching the baby, but you're still checking that monitor or anxious to go back to that baby. Some women have a hard time having anybody else hold their baby because what if you don't do it right? Or what if you don't do it well? Or what if my baby falls, right? So those are threats that can come in from an anxiety model. We have women, but very often, that are having a difficult time sleeping. So anxiety could be something where if I offer you sleep, I say, I'm taking the baby for 2 hours. Shut your phone. I'm taking your phone with the baby. Shut your phone, go into your room. I'm going to watch the baby for 2 hours. Could you sleep? And many women will say, no, because my mind is running, ruminating. I'm running 1,000,000 miles an hour, right? That's the anxiety that's presenting. Of, I'm having a hard time getting out of bed. I don't feel really motivated to talk to people. I'm isolating a little bit, or a lot. I'm having a hard time eating the things I should or could be eating. I don't have much of an appetite, or I'm eating chocolate only, like nothing else appeals. I'm not just feeling like kind of engaged with my baby. Maybe I even feel disconnected from my baby. I just don't feel like any level of attachment or bonding to my child. But very often in postpartum depression, we will actually see women who are taking care of their babies very well, but the minute they're done the task of taking care of their babies, they hand the baby off to somebody else. So I will feed my baby, and the minute I think they're done, I will say, here, take the baby, or I'm going to put the baby down on the ground, like in their infancy, or I might let the baby cry a little bit longer than they should be crying, because getting up to go take care of my child is just so overwhelming, right? The thing that I think is important to acknowledge is that when we're talking about, you'll say to me, but that sounds like classic depression and classic anxiety. Why do we have its own like kind of pseudo diagnosis? And for those of us who are really into the details, these do not exist in our diagnostic manual. The DSM-5 for the therapists out there, it's not there. We only have we have 2 qualifiers. We have 1 qualifier for 2 diagnoses. So one is if I can have generalized major depressive disorder with peripartum onset. Okay, it's pretty limited in diagnosis. It's not very relevant in terms of how we take care of people. But the idea is that it acknowledges that something changed when I had that baby, right? I maybe never even had depression or anxiety before, but if I have depression and it sets in within that first month after I give birth, that could be peripartum onset. We also have 1 other qualifier for bipolar disorder with peripartum onset. We'll talk about that later. The reason I think these things are important is that while it's not in the DSM-5, there's a lot of fear around trying to get it into the DSM-6, right? But what's most important is the continued conversation around how these diagnoses are relevant to this population. So let's say I have an anxious brain. I'm worried about getting sick. I'm worried if I'm dying. I'm worried if my neighbor's going to come into my property. I'm anxious that the mail didn't show up. Maybe somebody stole it, right? Like I'm thinking as an anxious brain. When I'm postpartum, my anxiety shifts and directs into a new object, and that's onto my child. Right. What if my baby is hungry? What if I don't feed enough? What if they're not gaining weight? What if they're sick? What if they get sick? What if somebody brings them germs? What if I'm poisoning my child? What if I'm thinking about, right? A lot of these kind of thoughts that are incredibly complicated because partly they feel like me being a good mom. Partly they're driving me absolutely batty, right? They're making me feel crazy because I can't quiet the intensity, okay? So postpartum depression, postpartum anxiety are most common, I would say. I think I want to talk a little bit about intrusive thoughts, and then eventually we're going to get to psychosis. But
Question.
I think yeah.
Devorah, is there an overlap between the 2? Like what if someone has a little OCD, a little depression, or a little anxiety, a little...
We like to say that anxiety and depression kind of hang out together. Either they're like bad cousins or best friends, depends on how you like to talk about it, right? Like they're best friends, they hang out together, which is actually evident in the fact that when we're treating anxiety, our actual first line of medication is like an SSRI, which is an antidepressant. So they definitely are kind of connected to each other. They overlap significantly. It's unusual that you would have somebody that has like exclusively depression or exclusively anxiety. That's a very important thing to think about.
Okay.
Yeah.
Thank you.
You want to talk about risk factors a little bit?
Yeah.
Okay. I'm curious, if you were to look back at your own story, you can choose not to disclose, but I'll throw it out
No,
there.
don't worry.
Do you have any risk factors associated with getting, let's say, postpartum something? If I don't want to diagnose you, I didn't do an intake or a history or a screening, right? But let's say you have something like anxiety, maybe some obsessive thoughts. Do you recognize within yourself any pre-existing risk factors that maybe could have told you, I need to be a little bit alert to this possibly presenting in pregnancy or postpartum?
So explain to me, what is a risk factor before I can
Something
answer that?
good. So a risk factor is something that says, if this is present in my story, then I have an increased likelihood of presenting with postpartum mood or anxiety disorder. So for example, if I have a history of depression, that's my number one risk factor of experiencing depression in postpartum. If I have a history of anxiety, then it's my number one concern that it could kind of explode or bloom in the postpartum period. Okay.
Right.
Things like any kind of losses, and you don't have to say what they are, but I'm just saying yes or no, right? A loss, a family history, any kind of history of trauma, trouble with finances, poor housing scenarios, poor supports in a family or in a marriage, people who've experienced even things like a grief of any form in that year. Those are some of the pre-existing risk factors that might make somebody at higher risk for perinatal mood or anxiety disorders.
Okay.
Thumbs up, thumb down. You're like,
No,
so
I'm laughing reading the comments because it's all my friends and my siblings. I definitely have OCD, and no one has diagnosed me, but I have OCD. There's no way around it. I have PCOS, so
Okay.
I normally take medication to get pregnant. I don't know if that could have been a risk factor or not.
So infertility would be considered a risk factor. So if you consider yourself dealing with some level of difficulty getting pregnant, absolutely, there's a risk factor right there. Right?
Okay, so then we could go with that. I probably have a few others sprinkled in there.
There you go.
If we wanted to go into my bio, yeah.
So I actually think the loudest one would be the OCD. So if, let's say, you have obsessions, which I think sometimes people like learn about what OCD actually is, and it's not like, yay, she has the cleanest house possible and I'm so jealous. That's not what OCD is, okay? OCD does not feel pleasant or comfortable. It's miserable. And the obsessions and the compulsions are there to quiet down the distress, right? So I do these things because I'm in such high distress and I'm trying to get more comfortable with my thoughts and with my life experience. And that seems like it resonates with you a little bit.
Yeah, and like,
right? Okay.
I need it to happen this way or I get frazzled.
Exactly. Because so in the obsessive mind, when the brain is dealing with these obsessive or intrusive thoughts, and this is a great time for us to talk about them, intrusive thoughts can make me very often in the pregnant and postpartum period, those intrusive thoughts relate to the baby. So let me give you an example of what OCD looks like in general. General OCD would be something like, the typical ones might be, I wash my hands, but I'm not so sure that I got my hands clean enough. I'm going to wash them again. Still not so sure. I'm going to wash them a third time, a fourth time. Maybe I even have associated a ritual. Like I know that if I wash them 5 times on the right, 5 times on the left, I know it sounds like we're washing till today, but like, we're 5 times on the right, 5 times on the left, and I wipe them like this, like this, like this, like this on my towel, then I have like secured safety and I'm reassured that my hands are clean enough for now. But the minute I start thinking about something like cooking in the kitchen or I touch my counter, I might think, oh shoot, my hands are dirty again. I have to do my rituals again in order to feel safe and grounded. An intrusive thought in a non-OCD brain would look something like, I'm driving down the highway, and this is kind of my most famous example of it because I absolutely experience these. I'm driving down the highway and I'm behind like one of those trailer trucks with all the cars piled on it, and I see the chains are rattling and they're making a lot of noise, and I'm going, What if that chain just broke and that cars all just fell off the truck and fell on me? I'm sure I heard a story somewhere of that happening, and I am scared. So what do? I move over, right? So I move my car over to the next lane and I keep on going. A healthy brain, a non-OCD brain, a not sticky brain, that thought is gone by the time I pass that truck. I'm able to convince myself that I have secured safety by just moving over a lane, keeping on going. I'm not having these intrusive thoughts of the cars falling off the truck, okay? Another intrusive thought, this one is totally mine. If I sit in an exit row on an airplane, I actually can imagine myself unlocking the gate, unlocking the door, pushing it out, and we all get sucked out of the airplane, right? What does my brain do? In that moment, I go, stop being a weirdo and order a Diet Coke and you're fine, right? Like, Diet Coke, please, we're good. I'm not going to do that. I'm not suicidal or homicidal. I'm not going to do it. But that's so weird that my brain like had this vision of me opening that door and we all get sucked out of the airplane, okay? Now, the OCD brain with intrusive thoughts after birth, what if I didn't clean that bottle well enough and I'm poisoning my baby? What if I forget if the baby's not full and I'm not reading their cues properly and I need to feed them again? And some of the most common intrusive thoughts are so powerful and so painful. We have women that experience intrusive thoughts like, I'm cutting vegetables in the kitchen. It's one of the most common ones. And I can imagine the knife jumping across the room. It's not a delusion. It is not a hallucination, but it's an intrusive thought that knife will jump across the room and cut up my baby. And I can see the blood on my baby. And I'm so scared that I actually will not cut vegetables in front of my baby when the baby's in the room. I would never harm my child. I don't want to harm my child. I don't want to think about thoughts about harming my child. But I have this intrusive thought about cutting vegetables, okay? Another common intrusive thought, we can call them intrusive or scary thoughts. Another scary thought would be, what if I drop my baby? So I'm walking down the stairs, what if I drop my baby? Or what if I throw my baby down the stairs? I would never do that. What kind of mother even has these thoughts about harming her baby? I would never do that. But what if I do that? What if I snap? What if I go crazy? What if I accidentally throw my baby? What if I do it? What if I throw my baby down the stairs? What if I drop my baby? So what does that mother do? You have any ideas of what that mother might do because she's so frightened by those thoughts?
She won't go down the steps with the baby.
No, or she'll tush bump down the steps, right? She'll bop down the stairs holding the baby like this. Those babies are incredibly safe with their moms. Those are not thoughts that are suicidal or homicidal. They are not psychotic thoughts. They are scary thoughts, but that mom knows those thoughts are strange. Those thoughts are uncomfortable. Those thoughts make me cry. And it's very hard to ask for help with those thoughts because there's such a strong sense of you're going to call. Need help really, really badly. And I'm asking you for help. So risk factors, the number one risk factors for any of these diagnoses is a history of that diagnosis before. You had it in pregnancy or in your past. That's the number one risk factor for having it in postpartum. Now, I think that, these are things that can sound like very overwhelming, but if you talk to people who've experienced, they're like, oh my God, you just told my story. I didn't know that was a thing, and because we've just named it as a thing that is so valuable from an educational perspective, right? You asked me, yeah, go ahead. Let me hear your question.
No, I'm just skimming of the questions. How does the postpartum, whichever issue it is, how does it go away? Is it just stages, or do I need to deal with it? And does it always need to be treated via medication? That's just
good question. That's a great question. So of the diagnoses that I just described to you, our first line of attack, really, first of all, I do not believe there is any mitzvah in suffering. I have yet to find anywhere in the Torah that it says there is a mitzvah to suffer. So if these experiences, these women are suffering, they are really uncomfortable with their thoughts, they're really uncomfortable with their moods, they're really uncomfortable with their feelings. They can really disrupt their relationships with their spouses, with their husbands. I didn't mention, but like some of the symptoms of anxiety can show up in rage. Like you're very irritable, like nothing is working. I just don't feel like myself. So I might really create problems in my relationship because I am not myself. In these thoughts and these feelings, I'm not myself. I'm in a lot of distress. And this is not what I wanted. This is not how I wanted my, I never wanted my first months of postpartum to be sad or in bed or me anxious all night long. Like, I'd like to enjoy it. I'd like to laugh. I'd like to smile. I'd like to have a good time. I'd like to celebrate my baby, you know, in person and on Instagram, but I'm not up to it, right? I just don't feel well. So since we know that the ideal is that someone feels good and healthy and enjoying and tired, right? But the good is the ideal, the healthy is the ideal. There's no reason to just wait it out. And I think it's one of the biggest mistakes we make. Is like we say, look, maybe next week it'll be better. Maybe next year it'll be better. No. First sign of defense, first sign of like responsiveness would be if you recognize any of the symptoms that I described, and it's causing you distress, it's disrupting your life, it's causing you problems in your life, your marriage, relationship, or just to yourself, like, I'm so sad, right? Get help by reaching out to a therapist who is specialized in these areas. I really want to emphasize how important it is that a therapist be trained in perinatal care.
Okay.
You can, you know, just by checkboxing it on my Psychology Today profile does not make me an expert. Ask them where they did training in perinatal mental health. You know, if they're looking for a therapist, they can reach out to me. I know therapists across the country. I'm happy to refer. Right? I said that very carefully, but like, you are welcome to reach out to me.
And also the SPH can direct them, but I have
yes, thank you. And SPH. I just want to make one more comment in terms of psychiatry. Okay. Psychiatrists also really need to be trained in perinatal psychiatry and reproductive psychiatry. That's a term. It's a training. Now, medication is crucial when it's necessary. It is life-saving. First line of defense is therapy, but it depending on how long this has been going on, medication, I want to get in there really quickly with medication because I can help them begin to feel much more like them. So disconnected for several months as they recover in postpartum.
Right. But so I have a question. Just how do I know if I'm just an overwhelmed mom or I have a mental health issue? Like, what if it's not to that severity of, oh, I'm not gonna walk down the steps with the baby, but it's more of like I'm constantly nervous and stressed. Do I still need to reach out?
Yes.
Does that?
So the reason I feel the answer should always say, am I really that bad? Is this really a symptom? Is this not a symptom? Like, let the experts help you. We have resources in our community, SBH being one of the premier ones, that can assess and support you and get you the resources that you need. You don't have to figure it all out on your own. And I think that's what a lot of people with mental health struggles do. They feel like I should be able to fix this. I can deal with this. I should just white knuckle my way through it. And I think that when you have resources available, again, why should you just feel unhappy? Why should you feel so uncomfortable in your own skin? Like, let's address this and get you the support that you need.
Definitely. Okay, thank you. Another question is, how do I deal with any family member or even a spouse telling me I'm overreacting because I want to get help or get medication or see a therapist?
Ooh, that's a good one, because that's fighting like generational stigma, right? Like, that's cultural generational stigma.
Yeah.
So I'm going to say something that's probably going to be like heretical, but like, I think if you're old enough to have a baby, you're old enough to make your own medical decisions. Okay, I'm going to say that again. If you're old enough to give birth, you're old enough to make your own mental health and medical decisions. And part of that is, while yes, thank God we get married young, we have babies young, but I'd like to believe that in the concept of self-determination and self-help, right? I have to believe that there are people that are smarter and wiser and better more knowledgeable than me. I can always decline services. I can always say, you know what, I really don't think I need this right now. But if you're asking, then find the support you need. And to be honest, your family doesn't need to know. Like, you don't have to tell them. There's a concept of privacy, right? They need to know everything. They might need to know everything else, but you don't have to tell them you're seeing a therapist.
I saw a therapist weekly via Zoom. I don't think even my husband knows.
Right.
We paid copay and it was like, it never happened.
Right. Look,
So
I would like to believe,
anyone who's thinking that, just definitely don't.
Right. Now, look, would I love for there to be communication between a husband and wife, that a husband would 100% want his wife to be well and would support her if she said, I think I need some help. And he would say, honey, I will do whatever you need to get you well and to make you feel and help you feel like yourself again, because I miss you. Because he's going to see she's in distress, right? Like, I miss you. I want you to be well again, you know, and she's saying, I want, and I'm asking for help. What a wonderful collaboration this can be. right? And honestly, like as a therapist, I like to bring that couple together in that first conversation, because I can get a sense of what's happening here. It's really actually the recommended pathway. I need to know what he's saying about what's going on at home, because she might paint one picture and he's going, that is not what is happening. It's way worse, right? She thinks she's in bed for an hour, but she actually doesn't get out of bed till 4, right? We need to have collaborative, like kind of information coming in from family members. But truthfully, you know, to the parents that are listening in and the moms that are listening, the greatest gift you can give your daughter or daughter-in-law is the support to get better, right? The number one thing you can give her is respite so she could sleep, because sleep is so protective. It's protective of physical and mental health. So, you know, if you say there's one thing I could do to make sure that I don't get depression or anxiety, I would tell you, make sure that there's a practice in place, like a plan in place that you'll be able to sleep. But in the event that you have a daughter or a daughter-in-law that's suffering or struggling, doesn't even have to be suffering, pay for her therapy if we need to, you know, but encourage her, say to her, you're going to get better. We're going to find the good help that you need. We're going to get you the people that can support you. I know just who to call, right? And I'm going to call that organization. I'm going to call SBH. I'm going to figure out a good person who's going to assess what's going on, and we're going to be pointed in the right direction. And I think that's the greatest you get. Yeah. And you're going to get better. This does not have to be a chronic lifetime diagnosis. There was a comment in there about like, if you get on therapy, you'll never get off therapy. No, if you have therapy and you get on medication, I'll never get off my meds. That's not true. That's not what we see. Not at all.
So a lot of the questions I see also on medication, I'm seeing like, what are ways to get over anxiety without medication? Obviously, we just said therapy would be a good one. Any other exercises or advice?
Yeah. So I think that what I'd like to say is that you can manage anxiety. I don't know that you get over it, but you can manage your anxiety depending on how high the anxiety is, and also how disruptive that anxiety has become. So I'm going to say that if it's not deeply impacting your functioning, then there are many ways that you can engage in kind of more holistic practices. So for example, exercise is one of our greatest assets that we can do. Exercise, walking, just taking a walk, even postpartum, taking a walk once you're medically cleared. Sleep is extraordinarily necessary. You will feel very differently if you've gotten sleep. Now, many women with severe anxiety can't sleep. So if you're dealing with a lack of sleep, we want to do everything we can to get you sleeping. I love that there's a term that I heard from a nurse practitioner who says, we need to get you well slept. She's a Southerner from North Carolina. And we got to get you well slept, you know. So well slept might mean I need to take medication to get to sleep, right? Like I'm going to have to take a sleeping pill through doctor's orders. Do not take your sister's or your brother's pills, but get medication, get to sleep, and then let's see how you feel tomorrow. Making sure that you are, if you're able to and you feel well enough to do so, reaching out to a friend. Can you come hang out with me? Can we take a walk? Can we talk on the phone? Engaging. People very often who are struggling can't do that. They can't. They feel very lonely and want to be alone. Support groups are incredibly valuable. We find that to be an amazing resource. Postpartum Disorders International, PSI, started as a support network. The woman who founded it, her kids would answer the phone and they say, you know, Postpartum Support International, Jane's office, it was their mom, right? She was in her kitchen and Jane would answer the phone and she would offer them support groups and connection. PSI started as a peer support network. And because we saw the studies that incredibly prove to us that connection with other people who are going through it really means that shows me, first of all, that I can get better, tells me I'm not different than too many other people, that there is hope for the future. So exercise, sleep, you know, I would always caution you against anything that would be considered like herbal or vitamin. Always, if you're breastfeeding, make sure you always clear anything like that with your either pediatrician or your OB/GYN.
Right. So what if you notice in someone, let's say my friend, she's not really acting like herself after she gave birth, but you don't know, am I supposed to tell her something? Is there like something subtle I could do to help? I don't want anything to come off in the wrong way, but I definitely noticed she's not herself. What advice would you give me as a friend?
So it's interesting because one of the things that I want to always be careful about is not assuming what I think is happening, right? I once made a terrible mistake. I totally assumed this woman was dealing with infertility. And I said to her, if you want to talk, and I'm here to support and to help and whatever. She was a friend. And basically what I found out, and she just goes, thank you. She didn't say anything. And she actually found out later that she was dealing with a mental illness, that at the time she was not able to continue to have children. And I was like, what an idiot. I thought she was dealing with infertility. She wasn't.
Right.
But you never know what people are dealing with, and we don't want to make that assumption. What I also feel, especially in the postpartum, we have women that have had very complicated births or labors, that they are physically in pain and that they should not, that we hope they're healing from. So we don't know why she's not herself. What I can say is I might say something like, Sarah, I'm worried about you. You just seem like you're struggling a little bit. And I want to be your friend, but I also don't want to be intrusive. But is there anything you want to talk to me about, or anything I can help you get connected with or support you in some way? And then be quiet and then just listen to what she says. And if she says anything like, it's just really hard, or I don't know, my husband's like AWOL, he's at work and he never comes home, and I can't even take care of my baby myself. I'm so tired and I haven't stopped bleeding and I'm in pain. That's where you say, hey, do you think you'd be willing to talk to somebody? I'm not an expert, but I know that I once heard this live on SBH, and I don't know, I learned something, and maybe you'd want to talk to a support person, somebody who can connect you, somebody who knows much more than I do. Would you be open to that? And hopefully from a kind and gentle and humble place, she can hear you, and you can offer her the number to SBH or a support group or whatever kind of support services might be necessary. I would not pathologize it. I would actually say, I know that a lot of people have a hard time after they give birth. And while I don't really know what's going on, I really care about you. And I know that I want you to feel like yourself, and I'm worried about you a little bit.
Right. So just lead them in the right direction, but don't give any advice. Okay.
Yeah.
Okay. This was very insightful. Okay. So I have, just to recap, who is the first person to call when you notice something up? Is it my OB? Is it SBH? When I feel off, where do I go? What do I say? Where do I turn?
That's a good question. Sometimes
how soon, like you
right.
said, the baby blues is 2 weeks. So at what point do I do something, and what do I even do?
That's a great question. So according to our DSM, right, from a diagnostic perspective, we don't really diagnose anything within the first 2 weeks, except for we're going to talk about psychosis in a minute. But I'm not going to diagnose anything within the first 2 weeks, pretty much. I'm going to say, this is hard, this transition. What can I do to kind of just address it more holistically and see if I feel a little bit better? Asking for help is number one thing. Before you even talk to your doctor, ask for help. Mom, can you come over? Mom-in-law, can you come over? Bubby, whatever. I just want you to hold the baby for 2 hours so I can take a shower, right? It's okay to not do it alone. Asking for help is the crucial beginning. The next person I would say actually is your OB, your birth care provider. And the reason I push you back to the OB is they're going to be the most accessible to you, right? You're going to be the one, they're still under their care within the first 6 weeks after you give birth. So going back to that OB and saying I'm really not myself. I'm rageful. I haven't slept in 3 days. My heart is pounding 1,000,000 miles a minute. Do I have eclampsia, or do I have anxiety? I don't know. I think I just had a panic attack. I don't feel like myself. Go to the OB and ask them that question. They may immediately prescribe. That tends to be what I see. Here's the name of a therapist, and I'm going to give you a prescription for Zoloft, and then off you go, because they're not therapists. So if you get a good traction from your OB and you get a good response, and hopefully someone who's supportive, they might say to you, I'd like you to reach out and get some services. Here are some numbers. That's when you can call SBH. When do we try to reach out for help? Again, no mitzvah in suffering. So if you feel like you're struggling and you feel like I'm just not myself, or I don't like how I'm feeling about myself or about my baby or about my life right now, right? I am having intrusive thoughts, or I'm feeling anxious, or my heart is racing all the time. My brain is running all the time. Get some help. It doesn't mean you are, it doesn't mean you're even getting a diagnosis. It just means you're asking for support. Historically, we lived in village environments. We lived in ghettos, right? Where did we live? Depending on what country you came from, but we lived in very close communities. We didn't live far away from our mothers, right? And our sisters, and the mother would send the younger sister to go help postpartum. The mother would come bring you into her home and help you after you gave birth. Today, we live very often across the country, right? Or far away, or another community, or there's this expectation that you're going to do it yourself. Maybe your mother still has a full-time job. Maybe your mother has a part-time job. Maybe your siblings all have children of their own. You don't necessarily have that, it takes a village experience anymore. You go to some of the tribal tribes in Africa, like it's amazing what they, in South America also, where they really are attentive to the new mom in a way that definitely is helping with recovery. We don't have that. We don't even have paid maternity leave, right? If we're really honest, the United States is not a mandatory leave. So we have this expectation I'm going to bounce back, that my body is going to bounce back in time for the bris, right? That I'm going to be right back to myself, and I'm going to look good and feel pretty and be fine. And it's not the reality on the ground at all. Not at all. Yeah.
Right. And why would you say, like, for someone like me who had the help, it wasn't enough?
Because
the whole reason I got connected to SVH was really by Hashem, by luck. Rachel's my cousin, and we talk all the time, and she kept checking in on me, basically assessing me without me going for an assessment. And she told me, like, Sarah, I want you to speak to a therapist. I think you'll feel much better. And I did do that, and whether I didn't stay in therapy for so long, only X amount of sessions, and I felt much better after, and I didn't need medication, but that was just my take and my story, and that's what I needed. But I'm saying, like, I had the help, and I had the nurse and even a cleaning lady, and yet I still didn't feel like I could leave, like I was myself,
sure.
like I want to do anything.
Because these are diagnoses. Because as much as I want to make it out to be something that happens in the transition to motherhood, or you know, sometimes these things are complicated, a lot of people struggle, at the end of the day, this is a diagnosis. And diagnosis means I need treatment. And so the therapy, even if it wasn't very many sessions, there was something about the therapy that was helpful to you. There was something that if you had gone on medication, you probably would have felt relief pretty quickly. Right? So because you did have the help and you did have the ability of people around you to support you, but it's not just about the help and it's not just about the sleep. A diagnosis is a diagnosis. Okay. Can we take a minute and talk about postpartum psychosis?
Yes.
Okay. So it's really important for us to have this conversation. Psychosis can be a feature of bipolar disorder, and psychosis by definition means that they have lost touch with reality. Okay. This is someone whose brain has gone offline. That their thoughts are typically not making sense. Sometimes what they say is not making sense. Sometimes their actions are very bizarre. But very often the things that they will say or the things they're thinking relates to themselves or the baby, but mostly relating to the baby. Things like, I think my baby might be Mashiach, right? Or we had one woman who, she would say things like, my breasts are talking to me. They're telling me when the baby's hungry. Okay. I had an experience with a woman who thought that the Rosh Hashiva was under her bed recording them, or that her husband stole her baby. These are breaks from reality. They are sometimes come along with hallucinations. They hear things or see things that don't exist. And sometimes it's their behaviors become very bizarre. So I was a consultant on a case where a woman who was a religious woman was wearing her bathrobe. She was 2-3 days postpartum, which is when it usually presents itself, right after giving birth. And she would just like walk outside in the living room with her husband, and her father was sitting there, and her robe would just fall open. And her mother would yell, "Cover yourself up." And she would cover herself. And then a few minutes later, her robe would kind of fall open again. She wasn't talking very much, but clearly she wasn't there. Her brain wasn't working. That is a psychosis. Sometimes that becomes the first time a woman gets a diagnosis of bipolar disorder with psychotic features. It is always an emergency. And by that, I mean, this is a medical emergency. And there is a strong correlation between psychosis and a woman harming herself, or killing her baby. When you see news articles of women throwing their babies off a roof, killing their child, drowning their babies, with almost 100% of surety, they did not have postpartum depression. They had postpartum psychosis. And it was missed, or was misdiagnosed, or untreated, or undertreated, or she went off her medications. When this happens, it usually happens within the first 2 weeks of postpartum, and usually within like the first week. And it is an emergency, which means that you cannot leave her alone with the baby, and she does need to be hospitalized. We do not treat this at home. If you have any concern that this is happening, this is an emergency call to your physician, right? It might just be, let me take my friend, my wife, my whatever, to the hospital to be assessed. There are certain hospitals that have a perinatal psychiatric ward. There's a few of them in the country. There's one in New York called at Northwell. It used to be it used to be Zucker Hillside Hospital, the one up on Long Island. There is a perinatal unit there for women with postpartum psychosis. So again, psychosis is not intrusive thoughts. They also have these, I'm going to call them bizarre thoughts, but they don't think they're bizarre. We would think they're bizarre. They say them out loud and we're kind of going, what are you talking about? The Rosh Hashiva's under your bed. But to them, the thought makes sense. Intrusive thoughts from OCD, that woman is devastated by the thoughts, terribly distressed. What kind of mother would think that way? And those children are very safe with her. If you're not sure, ask for advice, get some guidance, get some support. Okay.
So somebody just asked, is that anything like you thinking you hear the baby choking or crying, but in reality, that's not what's happening?
So what I would say to you is that if it's something that is like happening in the middle of the night and you just kind of it's very normal to hear your baby crying when the baby's not crying. We actually have that, but we have that sometimes with perinatal loss. A child has died and a mother will hear the baby crying out of the crib, right? With like an infant loss. But in this case, I would not necessarily diagnose that as a delusion or hallucination because she becomes aware that there was no baby crying. That's so weird. I wonder what I heard. But if she is in a delusion or she's in a psychotic episode, she still hears that baby crying. She's like, oh, don't you hear the baby crying? I hear the baby crying. The baby's still crying. Meaning I can't, right? She is not correct. Yeah, exactly.
Somebody else just asked, does psychosis go hand in hand with other disorders like dissociative identity disorder?
I don't know that I can speak specifically to DID, but I definitely is a potential feature of things like, of course, schizophrenia, of bipolar disorder is the primary one. There's a population of women that just have what we call like an acute brief psychotic episode, which is only in the postpartum, but more likely we're having somebody who has a history of bipolar disorder and then they go into a psychotic episode post-birth. Anybody who has bipolar must discuss pregnancy and postpartum with their physician. Nobody's going to tell you, well, nobody should tell you not to have a baby, but you definitely need to have a good plan and good safety, a good safe, like kind of status preferably before going into pregnancy and postpartum.
Okay, that's interesting.
Yeah.
Okay, wow, Devorah, thank you. I just have, I have one question that I think, honestly, you were supposed to ask it to me, but I would feel like I want to ask it to you. What should I do differently next time, like God willing, if and when I have a third kid?
It's so great because first of all, in an ideal situation, you have a plan, right? This is a plan. Like I know that I want to have another baby. I'm going to speak to if I would draw you a postpartum plan, or pregnancy postpartum plan, I would be, I'm going to describe it the way that I would like it to be done, then you can do whatever you want. But if I would like it to be done, I would have a consultation with a psychiatrist, a perinatal or reproductive psychiatrist. And I would say, hey, this is what happened in my previous birth. This is how I recovered. I'm wondering if this were to show up again postpartum or in pregnancy, because very often many of these symptoms actually are showing up in pregnancy. What would you suggest I do? And at what point should I come see you? So you have your team lined up. I would say, okay, if I'm going to do this again, I need to make sure that I have a good plan for sleep. You had help last time, making sure that you have somebody who's going to cover you for sleep. Also, a conversation with a therapist around like, what would be something that could help you in the postpartum period? Let's say I'm going to make sure that I'm in therapy once every 2 weeks, just to see how I'm doing, to check in, because I also will have memory of what happened after baby number 2. And that could be distressing, right? So it could be like my body remembers how uncomfortable I was after number 2. And here I am in number 3 and I do feel a lot better and I feel much more stable, but I'm remembering how sad I was after the baby number 2. Or I might even feel like regret that I had such a hard time postpartum. I didn't attach to my baby the way I wanted to, or I was really mean to my husband or whatever, right? Maybe I was mean to my mother-in-law, something like that, right? And can I kind of recognize that my body and brain will remember that in baby number 3? But of most importance is everything we're doing here. Knowledge is power. Knowledge is 100% power. You're walking into this space. If you were to have another planned pregnancy and baby, you would know so much more than you knew before. And so, right, scary or powerful, right? It could be empowering, it could be scary, but I would like to suggest to you it's empowering. You know how your brain works, you know how your body functions, you know what works, you know what probably would work well, and you be flexible in pulling from those resources. You know, maybe you have cousin Rachel. Rachel, check in with me 3 months, 6 months, 7 months, 8 months in the pregnancy. Once a month, you're gonna take me out for coffee. You're gonna check how I'm doing. And Rachel will be your cousin and also your friend and also tell you how you're doing. When I had my babies, I would talk to my friend. I would say, you'll check in on me, right? You'll make sure that I'm not losing, like I'm not having a hard time, right? I won't know if I'm having a hard time, but you'll tell me if I'm having a hard time, right? We would check in on each other. But I think that planfulness, patience, and also that kind voice in my head that I will get through this, I will figure this out. It can be really hard, but I can figure it out because if I get the right support and I get the right connection and I have the right resources, we're going to do okay.
Right. So get a team in place. Okay. And then I know we have to end, but I just got a few questions. I'm going to skim them quickly. Okay. Can this happen to women without any history of any disorder?
Yes.
Or is it mainly to people that have issues before?
No, it can happen to anybody. 1 in 5 women.
Okay. And why do hospitals or OBs not talk about this more? Like why do we not know anything?
So I would say to you that partly because it's probably some kind of a pamphlet that you got in the minute you delivered that you just put in your overnight bag and didn't look at. Many hospitals are giving out information. Some of you might even have been in an OB office and have been screened by something called the Edinburgh or the EPDS. And then you like answer 10 questions and you're kind of like, nah, but I don't know what that was. And you put it away and you don't even think about it, but somebody screened you. It's a mandated screening, although many hospitals and clinics are not yet doing it. Some of our OB offices are not. The main reason we're having a hard time screening is the lack of resources for response. So if I screen high on the EPDS, right, that means that if I screen high on the EPDS, that means that I have to now I have to be referred somewhere. So I say to you, I'm your doctor, and I say to you, oh, honey, you screen really high on the EPDS. I want to give you a name of a referral. Here's the name of 5 perinatal therapists that I refer to. You call every one of them and they're full. Every one of them do not take insurance. And every one of those therapists don't take new clients. You just sent a potentially very distressed, sometimes suicidal woman out into the world, and we don't have enough resources for her. So very often OBs are like a little bit nervous to screen because I don't trust that I can refer her properly. So I'd rather not know because it's a liability. I know that sounds mean, but it's accurate. I think we can do so much better. And I think there's a lot of really fabulous initiatives to make it better, but we have a long way to go. But we're doing the really. So sometimes our education won't, and you know, sometimes our education won't necessarily come from our OBs. Our education is going to come from TikTok and from Instagram. And that's a new way of the world. And we better get used to that. The OBs better get used to it, but also the people who are using these platforms are actually getting a tremendous amount of knowledge and information from these platforms like we're doing tonight.
Right. Okay. And is it likely to present itself again if you had it once, or is every pregnancy different?
No. It is likely to present itself again. Remember, the highest risk, the greatest risk factor for a perinatal mood disorder is having had it before. So either previous pregnancy or in pregnancy or previous, prior to pregnancies. Yes, but here's the thing. If I'm stronger and smarter and wiser, I discuss this with my provider and I say to them, I am going to get pregnant again. I'd like to get pregnant again. What's the plan? Sometimes the plan is the minute that we see that you become like really anxious or depressed, we're putting you on medication, we're getting you into therapy right away, right? I think it's important for us to know that our studies are very, very, very strong in support of putting women on keeping women well in pregnancy and postpartum. And I just have to put out a plug for medication that our studies show that, when we measure between medication in pregnancy versus depression in pregnancy has higher risks associated with it. So exposing the fetus to depression versus exposing the fetus to medication, this is worse. Okay. So it's not like, oh, well, there's no risk if I don't take any medication. No, we have actually neurodevelopmental risks in the fetus, in the developing baby, when exposed to a mom with depression and anxiety. So we want you well. We want you healthy. We want you feeling confident and well in your pregnancy. And if that takes medication, you're actually minimizing the risk of problems with your baby by not exposing your child to depression. That's sometimes a little bit of a hard thing for people to wrap their heads around.
Right. The fear of medication.
Correct.
Okay. And before you leave me, somebody reached out to me about postpartum depression. They felt like they need a little bit more clarity on that just before we end. So
Sure.
I know you explained it, and we did discuss the difference between the anxiety and the depression, but if we could go more into the depression, give me like the nitty gritty details of like
Sure.
what
The
she
symptoms.
feels. Yeah.
Yeah. So it's the symptoms of depression: low motivation, a hopelessness, a helplessness. I don't know what to do with myself. My mind, I have a very hard time focusing or coping, feeling like I'm like a brain fog goes along with that. Like my mind is just muddled or like messy. My memory feels like it's lousy. Like I'm not remembering. I just read a whole magazine. I have no idea what I just read. Irritability can go along with depression as well. Hiding under the covers, like not having a hard time getting out of bed, sleeping very little or sleeping too much. It's both. Eating very little or eating too much, either extreme. Sometimes we have it as weight loss, and postpartum, that's a little bit wonky because, you know, we're hoping to lose the weight from the pregnancy, but weight loss that happens a little bit too quickly because I haven't eaten, because I just don't have an appetite, isolating from friends. Those are the primary symptoms of depression. Sometimes it's suicide as well. Suicidal thinking. I'm thinking about killing myself because I just can't handle this, or I don't feel like myself, or I'm embarrassed about how I feel. Those can all show up in depression as well.
Wow.
Yeah.
And is a person who's going through this, do they always know that they're going through this?
No, I don't think so at all. No. And that's why I think it's so crucial to do this kind of education, but also to have somebody else assess me. Now, I'm in touch with myself and I'm in touch with my feelings and my moods for sure. If I don't know, if I don't have the language to offer you what I'm going through, it's difficult for me to tell you anything other than I just don't feel like myself. But if I know the language of depression or anxiety, I might say, my mind hasn't stopped running. I'm ruminating all night long. I totally am dealing with insomnia because my mind just doesn't quite shut up, right? And I'm constantly worrying about the baby. I'm checking on the baby 15 times a night. I'm having intrusive thoughts, right? I have the language to communicate. I've had therapists who've been in a training with me who go, wait a minute, anxiety is a thing? Postpartum anxiety is a thing? That's exactly what I had. I had no idea. I knew it wasn't depression, but I didn't realize that postpartum anxiety is a thing, right? It's a thing.
We give them the info. Okay.
Yeah.
Wow, Devorah, this was a lot.
Helpful?
I feel very helpful. I feel even for myself, I feel a weight lifted off my shoulders. Like you reassured me that what I felt and I was not crazy. And for anyone else out there who's going to be pregnant or has had these feelings, you're not crazy. This is very real. The same way it's hard for people to get pregnant and to stay pregnant, it's hard after you have a baby. So everybody just please reach out. SBH has a huge branch on postpartum, perinatal, everything. I know their name, like we said, is the Fertility, but that is totally not what they encompass. They are all encompassing, and there's a lot of resources out there. Do not be ashamed. It takes one phone call and someone could just tell you, don't worry, I think you're good. Just we'll reach out in another few weeks and check in on you. And that's all it could have led to, or it could lead to something more where you get the help that you need.
Absolutely. I wanted to say one comment. This was an intense conversation, right? So for some of you who maybe actually joined us and stayed with us the whole evening, if this brings up memories for you, either a very recent memory of your postpartum experience or an older memory of 5, 7, 10 years ago of what your postpartum period was like, and it brings up feelings and memory that are hard for you, take care of yourself tonight. Pay attention to what you're feeling in your body. Pay attention to like how your heart is pounding or not pounding, right? Right, Rachel? Like just pay attention to yourself. Be kind to your heart, be kind to yourself. Think about like when we get off the phone tonight, don't jump onto, another call. Don't jump onto a Netflix video. Just sit with those feelings for a moment and allow yourself the permission to say, I am smarter, I am wiser today, and what I know today is going to help somebody else. And it may help me in a future pregnancy, but most importantly, like I can help. By our having these conversations, it helps the entire community. But be kind to your own heart. If it's heavy on you tonight, I see you, Rachel. I see you, Sarah. Like it's hard. It's hard. It's heavy.
Yeah.
That's okay. You can go off the camera. It's fine. But like, it's hard. And I think what you're showing is that integrity of this conversation. It's real. And the fact that we can do it in a confident and competent manner doesn't mean that it doesn't have a lot of feelings associated with it. And so for everybody on the call tonight, be kind to yourself and pat yourself on the back for being here with us and for learning and for for being an advocate for others who need it. So thank you. Thank you. Thank you.
Thank you for giving us your time. You are
Pleasure.
incredible. You are really
Thank you.
a phenomenon. Thank you for being here.
Thank you. Thank you. Good night. So nice to see you.
Thank
Take
you,
good care.
everyone, for tuning in.